Stepping on a rusty nail seems like a minor mishap. It's a universal experience, a story we often share with a chuckle. However, beneath the surface of this seemingly insignificant event lies a potential danger we often overlook: tetanus. While the rust itself doesn't cause tetanus, it's often a sign of conditions that favor the growth of Clostridium tetani, the bacteria responsible for this serious illness. Imagine this: you're strolling through the park on a sunny afternoon enjoying the fresh air. Suddenly you feel a sharp pain shoot through your foot. Looking down, you realize you've stepped on a rusty nail. This scenario, though common, can quickly escalate from a minor inconvenience to a serious health concern. Understanding the risks associated with stepping on a rusty nail and knowing the appropriate actions to take can make all the difference. Let's delve deeper into the hidden dangers of this common mishap and learn how to protect ourselves. Tetanus is a serious bacterial infection that affects the nervous system. It is not the rust itself that causes tetanus, but the presence of Clostridium tetani bacteria, commonly found in soil, dust, and manure. These bacteria thrive in anaerobic environments, places with little to no oxygen. When these bacteria enter a deep wound, like one caused by a rusty nail, they multiply and produce a toxin that wreaks havoc on the body. This potent toxin, called tetanospasmin, disrupts the communication between nerves and muscles, leading to severe muscle stiffness and spasms. Understanding the nature of this bacterial infection is crucial in grasping the severity of stepping on a rusty nail. While tetanus is relatively rare in developed countries due to widespread vaccination, it remains a significant threat in developing nations with limited access to healthcare. Rust itself doesn't directly cause tetanus. However, it's a visible indicator that the object has been exposed to the elements, air, moisture, and dirt for an extended period. This exposure increases the likelihood that the object is harboring Clostridium tetani spores. Think of rust as a warning sign. It's a visual cue that the object has been in an environment where tetanus-causing bacteria are likely to thrive. While a shiny nail can also harbor these bacteria, the presence of rust raises a red flag, signaling a higher risk of contamination. It's important to remember that tetanus is preventable. By understanding the role of rust as an indicator of potential danger, we can take necessary precautions to avoid this serious infection. Tetanus, often referred to as lockjaw, is characterized by painful muscle contractions, particularly in the jaw and neck. These spasms can be so severe that they interfere with breathing, leading to life-threatening complications. The onset of tetanus symptoms typically occurs within 2 weeks of infection, although it can vary from a few days to several months. Early symptoms may include muscle stiffness, especially in the jaw, neck, and abdomen, difficulty swallowing, headache, fever, and sweating. As the infection progresses, muscle spasms intensify, leading to seizures, difficulty breathing, abnormal heart rhythms, and high blood pressure. Tetanus is a serious medical emergency that requires immediate medical attention. Early diagnosis and treatment are crucial in improving outcomes. If you step on a rusty nail, don't panic, but do act quickly and follow these steps. First, control bleeding by applying gentle pressure to the wound using a clean cloth or bandage to stop any bleeding. Second, clean the wound thoroughly with soap and water for at least 10 minutes. If possible, irrigate the wound with clean running water to flush out any debris. Third, apply an over-the-counter antiseptic solution, such as hydrogen peroxide or povidone iodine, to further disinfect the area. Fourth, cover the wound with a sterile bandage to prevent further contamination. Finally, seek medical attention immediately, even if the wound seems minor. A healthcare professional will assess your tetanus vaccination status and provide appropriate treatment, which may include a tetanus booster shot and antibiotics. Vaccination remains our most potent weapon against tetanus. The tetanus vaccine, usually combined with diphtheria and pertussis vaccines, or DTaP, is highly effective in preventing this debilitating disease. The DTaP vaccine is typically administered to children in 5 doses, starting at 2 months of age. Booster shots are recommended every 10 years throughout adulthood to maintain immunity. If you've stepped on a rusty nail, your doctor will determine if you need a tetanus booster shot based on your vaccination history and the nature of the wound. In general, a booster shot is recommended if your last tetanus shot was more than 10 years ago, or if you have a deep or dirty wound and your last tetanus shot was more than 5 years ago. Remember, vaccination isn't just about personal protection. By getting vaccinated, you also contribute to herd immunity. protecting those who are unable to receive the vaccine due to medical reasons.